Hello, I'm Charles Ling. I'm re-recording this talk because the original one has some audio problem. So the title of this talk is GlucoGuide, a personalized recommendation system for diabetes. These are my collaborators, Dr. Pachula, and our students, and our granting agents. In this talk, I'll talk about data analytics and how it could help to improve values or how to improve people's life in the big data landscape. Okay, so first I want to talk about diabetes a little bit from a layman's point of view. So diabetes is about glucose or blood sugar. So here is a sort of a demonstration of how the blood sugar will look like for a normal person. So this axis is about time, right? So here's breakfast, 1 hour after, 2 hours after breakfast, and then lunch, 1 hour, 2 hours after, and then dinner, 1 hour, 2 hours after, and then you sleep. Okay. For a normal person, his or her blood glucose throughout the day will look like something like this. It does goes up and down. It depends on your food, actually. So whenever you eat food, the carbohydrate in the food will be converted into glucose or blood sugar, which will secrete into your blood, okay, so that your blood sugar will go high. But then your pancreas will secrete something called insulin. The insulin then will signal all the cells in the body to take those glucose and store them as energy, and therefore your glucose will drop. Okay? So throughout the day, if your blood glucose is within sort of these two lines, you're fine. Okay? And stable blood glucose is actually very important for your whole body and for your brain. How about diabetes? Well, for diabetes patient, the blood glucose throughout the day may look like this. And that's because there are two possible reasons. One is for type 1 diabetes, the pancreas just does not secrete any insulin. This is type 1 diabetes. In the type 2, the pancreas secrete less insulin, or the body cells are not sensitive to the insulin. So the blood glucose goes very high. Whenever the blood glucose is very high, above these 10 line, then it actually becomes very problematic to people. Diabetes is a silent and slow killer. It is silent because people usually don't have any symptoms. People don't know about it. Okay? Maybe sometimes you feel thirsty, but otherwise you don't feel anything. But it's a slow killer because over the months and years, it will have very serious complications. Over the years, it will damage your nerve endings, block your veins, etc. It will convert the extra glucose in the blood into fat. So, it's stored in the belly and hips. And it will lead to high blood pressure, stroke, heart attack, ED, blindness, amputation, memory loss, etc. Maybe over 5 to 10 years of time. But then until then, it's too late. Right? So it's really a very serious issue, and it's a silent slow killer. I have some gruesome pictures, so if you have a weak mind, look away. So for example, amputation and blindness, these are all the complications of diabetes. Well, diabetes in the world is epidemic, right? Over the world, there's 380 million people have diabetes, and it's increasing. In Canada, Canadian Diabetes Association estimated that 9 million Canadians are either diabetic or pre-diabetic. And that's nearly 1 in every 4 Canadians. That's including everyone, infants, old people, etc. And 90 to 95% of these diabetes are type 2 diabetes that I mentioned earlier. And it is strongly linked to poor lifestyle. Okay, so if one has already diagnosed as type 2 diabetes, what would happen? Well, normally you will see a doctor, right? A specialist, which will prescribe medicine to you. And then you also see dietitians and go to education center, and they will give you tips on how to make lifestyle changes, such as food you eat or exercise, etc. And then you will be just left alone because it's something called self-management, right? So you'll be giving some guidelines and you go home and you do this lifestyle change yourself. But the guidelines are very complicated. So these are, for example, the guidelines from the Canadian Diabetes Center, Canadian Diabetes Association. As you can see, it divides into food into many different categories. Okay? And for each category, it will have choose more often. These are supposed to be healthy food, and also choose less often. And then for each category, it has different kind of, for example, carbohydrate here. And it also have like how much carbohydrate, serving size, how much carbohydrate, how much protein, and how much fat each component will be. So for a diabetes, it's supposed to look up all these tables and in each meal find out what's the total carbohydrate, total protein, total fat, and whether that's reasonable or not. Okay? So this is a highly complicated process. Nobody can remember these or bring all these big tables into the dinner table. And this is especially complicated for mixed meal, right? When you have a plate of many things. So, in addition, those guidelines are not personalized. Right? They are just guidelines for everyone. And during these months of time you are self-managing, there's very little support for you. You don't see doctor, you don't see dietitian because they're all very busy. So usually diabetes patients get worse over the time, over the months and years, and they usually will need more pills, and then eventually they will probably need insulin. And the lifespan of diabetes will be shortened by 5 to 10 years and cost Canadians billions of dollars. So how can data analytics help here? Well, needless to say, smartphones or tablets have already revolutionized our life. And there have already been many apps, right, on the smartphone or tablet that can allow diabetes patients to enter their lifestyle data, but most of them can only record, plot, and track these data. Okay. For example, two notable ones, GlucoGuide, a US company, right? They are busy working on connecting all these devices like glucometer into the cell phone. So the recording will be easier. And WellDoc is another US-based company that they will have logging information of the lifestyle, and then the doctor will also be able to log in and maybe change medicine, make recommendations to the patients. None or few of the current apps can actually have data analytics ability that try to find out why the patient will have high blood glucose level. And this is a GlucoGuide, our system. GlucoGuide is data-driven, personalized, and it will make recommendations to patients on what lifestyle change you should have to maximize, to have a better control or best control of your blood glucose. And data analytics is my research for over 20 years, and this is a research driven by this killer application, that is how to improve diabetic people's life. So here is briefly, how GlucoGuide works. So again, a patient would will enter or log his or her information about glucose, food, etc. through the cell phone. And then those data will be then transmitted wirelessly, securely, to our server, which could also be called a cloud, where then data mining or data analytics is applied to find out which factor in the lifestyle that can most affect the patient's blood glucose. And then these recommendations generated by the algorithm may be verified by a medical team, and then it will be sent to the patient's smartphone. Okay? So for example, this one will say, after mining your data, aerobic walk has the largest impact to lower your fasting blood sugar. Have an aerobic walk today, set up a reminder. Okay. And then if the patient does walk, have some aerobic walk, then this information could be detected through the, through the cell phone, right? And then the data will be then uploaded to the server again, and our server will send encouraging messages maybe next day saying, great job in taking the aerobic walk, which has lowered your average blood sugar. Do that every day. So it's interactive. Every 1 or 2 days, it will send you this kind of recommendation to keep you engaged, to encourage you, and to make your blood sugar into good control. So this is a homepage of GlucoGuide. You will see that you can enter glucose level, diet, exercise, and blood pressure, etc. information. This is a screen for people to enter the food information. Okay? And again, you can search. You can use the search to search the food, and then it will list a bunch of food here. One thing I want to add is that you can see that these food actually are already colored, because we use data analytics to analyze the food components. We have 60,000 food items in the database. Okay? To analyze these 60,000 food to see which food is more healthy, which food is not healthy for diabetics. And the red one are not supposed one you take, the green one are good to take. So we want to be more proactive. Before even they choose the food, they will know that which food is more healthy. But you know, food entry is always a tedious process. Okay. Later on, I'll talk about how to improve them. Right now, we still use the keyword search or even search with a voice. You can speak to it and I'll search. Okay, so to evaluate GlucoGuide, we actually have run a clinical trial. The clinical trial, it's a small one, involves 17 patients, either type 2 diabetes or pre-diabetic, and these are the information about those patients. And divided into control group and intervention group. Evaluation, briefly. So early on, I showed that the blood glucose goes up and down throughout the day, right? So therefore, you could use your home meter to check your blood glucose, but that's not very accurate. So there's one test called A1C, which you need to go to the lab and draw the blood, and the lab do the test. This A1C is very important. It gives you an average blood glucose level in the past 2 to 3 months. So next time when you go to see your doctor, ask the doctor to the A1C, because that will give you a much better view of your blood glucose in the past 3 months. So what is this A1C? Well, A1C has several ranges. So if A1C is less than 6%, it's normal. You're normal, right? You don't have diabetes. But if A1C is between 6 to 64.4%, then you are in the pre-diabetic range. And if it is greater than 6.5%, you're diabetic. And could go as high as like 12%, etc. Okay. And you can see that the range is very narrow, right? So the difference between 0.3 different from 4% can make a big difference here. So the result on this clinical trial is that GlucoGuide users achieved an A1C reduction, the reduce on the A1C, a mean reduction of 0.36%. Okay, and if those patients adhere to our recommendation from the GlucoGuide, then they will achieve 1.23% reduction. So if you look at, again, these ranges here, you will see that this will really potentially, this amounted to changing a early diabetic into pre-diabetic, and pre-diabetic to normal, or even directly from a early diabetic into normal because of these numbers. So the result is very promising, even though it's a very small clinical trial. And this happened when those people use GlucoGuide for 3 months and with lifestyle change only. That is, there's no medicine change. So I want to talk briefly about our current and future work. So early on, I mentioned that it is still very difficult to log in the data, right? To enter the data, especially the food information. And also the meters, all these different kind of meters, right? So how can we improve that? Well, I want to tell you some ingenious ideas we are working on. I think this will really make it much easier for people to use. Well, all the cell phones, smartphones these days have a high quality camera. So can we do something like this? When you have a plate of food, instead of enter the food item and do a search, can we just use camera to take a photo of the food, and right there it will analyze the food, and say how much carbohydrate, how much protein, how much fat it is. And if it's already over, it can already show you maybe it's already, you're already taking too much there. So this will be much easier. And this could happen even for meters. Rather than using Bluetooth to pair the meter and all that, you can take a picture of the readings, right? And then this way, then you can immediately get a reading and then store the data. So you don't need to worry what type of glucometer that you use. Well, at least to do this first part, the food recognition, is really difficult. No apps out there these days can do this, or can do this well. I mean, no app can do this at all. So to do this, we are doing a very recent research called deep learning. Deep learning is one of the machine learning areas that are very recent, that is employed, that is studied in Google, Microsoft, and all these companies, Facebook, try to analyze images and voice. So we are also researching deep learning to see how it could help to recognize those food directly. So that's one direction. The other direction is that we want to have some implicit and visual recommendation. Remember earlier we have text recommendations, right? But we want to have some visual recommendations. So here's what we think that the future GlucoGuide will be. So in the future, for example, on diet, right? When patients, enter their food or take camera of the food, instead of, we will show them a plate like this. Okay? In this plate, they will have this plate size, which is normal, usual, but then it will show different components of the food that is not enough, or is over, too much, or that's not good. So color we use color to represent how good each component is, and we use the portion size to represent, whether it's too much or it's too little. And if we want to recommend patients to eat less carbohydrate, what we will do is we just make that portion of the carbohydrate smaller, so that even if you eat the same amount of bread, right? In a few days it will be over, and then it will naturally make the patient eat less, right? So we can use this kind of visual tool to make implicit, hidden recommendation. We just send patient different plates over the time, okay? And I think this will also make it much easier, much better, and visual, and easier for people to adhere to these recommendations. So to summarize, I want to talk about two, maybe perhaps controversial ideas after over 20 years of research on data analytics. One is that more data is perhaps more powerful than smart software, especially these days when we can get a lot of data cheaply. So data analytics or big data is very important. The second is that a research driven by killer applications is more impactful than research-driven applications, whatever it is. And if our research can be driven by this kind of killer apps that can change people's life, then this research would be very impactful for sure. And we want to make this GlucoGuide into the world so that people can all use it and change their life. So thank you, that's the end of the talk. And if you have any questions, please email me. Thank you.